Hi, my name is Shawver. I'm a student physical therapist with the University of St. Augustine. How are you doing today?
I'm good, how are you?
Good. Can you just go ahead and confirm for me your first and last name?
Yes, it's Jacqueline LeMay,
And then what's your date of birth?
October 13, 1989.
Perfect, that's what I have. So I'm just understanding that you're having some low back pain, is that correct?
Yes.
Okay, so to help treat that, we're going to do some traction on your lumbar spine, which is your low back. What it's going to do, it's going to help to increase your muscular blood flow, and it's also going to cause some separation of your vertebrae. All this is going to do is it's just going to decrease your pain and increase your range of motion, which is your ability to move. I did check your chart. You don't have any of the precautions or contraindications, so that is good. To do this treatment, I'm going to have you laying on your back on a table, and you're going to be placing some straps around your ASIS, which is just your hips, and then along your lower ribs. Is that okay with you?
Yes.
Good. Okay. So before we begin that, I'm just going to need to check your skin and just kind of see where your pain is and everything. So can you go ahead and stand up for me?
Yes.
Okay. And then go ahead and spin. Is it okay if I pull up your shirt a little bit?
Yes.
Okay. So I'm just going to palpate the lumbar area, and then just let me know if you feel pain.
Mm-hmm.
Yeah, you feel some pain there?
Yes.
Okay, so now I'm just going to check your range of motion. So what I'm going to do to do that is first, I understand you're having some difficulties with flexion, which is just reaching forward and touching your toes. Is that correct?
Yes.
Okay, so to do that, we're just going to have you reach down and touch your toes, and I'm just going to measure from your middle finger to the floor, okay?
Okay.
Go ahead and do that for me. Perfect. And it looks like you have about 3 inches, so that's great. And then I'm also going to have you bend over to your side like this. So you're just going to run your arm down. Good, but you're going to go ahead and do your left side. So we're going to do it that way. Perfect. I'm just going to mark where that is, and then come back up to neutral, and then mark where that is, and measure that. And that's about 5 centimeters. So after this treatment, that should increase your range of motion after that, okay?
Okay.
Okay, so now we're going to set up this. It's just a whole bunch of straps to help keep you safe. So this is going to go around your back. I'm just going to place it around your ASIS. I'm going to palpate your ASIS. It's right about there. And we want it to fit nice and snug, but not too tight, okay? So how does that feel?
Good.
Okay. And then this belt is going to get hooked in. I'm just going to move around you. Okay. Perfect. And then this one goes between your legs. I'm just going to make sure it's not tangled at all. It's not. Okay, perfect. Now you can go ahead and lay down on the table. You lay with your feet up here, and then your back on here. We can move things as needed. Perfect. And then I'm actually going to have you put your legs up and move it a little bit further back. So you're at a nice 90. It's going to go through there. And then this is going to just get wrapped around your upper ribs, or your lower ribs, sorry. So, again, nice and snug, but not too tight. How does that feel?
Good.
Good. Okay, so it looks positioned nicely. I'm going to unlock the table. This moves with you. Great. Okay, and it looks like it's at a nice height. Everything is good. Okay, now we're just going to go ahead and set up the machine, okay?
Okay.
Okay, so because you are having some pain, we're going to go with an intermittent, and then we're going to change it. You weighed 200 pounds, so we're going to go, the max we'll start this treatment is 50 pounds. So that way it's 1/4 your body weight, since this is your first treatment. And then we're going to do a 1-to-1 ratio. So we're going to do 20 seconds on, 20 seconds off. And we're going to say an intermittent. And we're going to go for 15 minutes. Okay, so now that you are properly set up, I just want to make sure that you are aware this is the stop treatment button. So I'm just going to give this to you. Just make sure at any time if you feel any pain or discomfort or you want the treatment to stop, you just hit that button. Okay?
Okay.
And then I'm also going to give you a call bell. So just hit this at any moment, again, if you're feeling any pain or discomfort, or if you just want me to come over, but I'll be here the entire time.
Okay.
Okay? So now we're going, since the machine is set, we are just going to set this up. I'm going to hold on to the rope. Good. Okay, now we're just going to go ahead and start the treatment. How are you feeling?
Good.
Good. Okay, and this treatment is for 15 minutes, and the machine is just going to again pull on and off in the intermittent setting. How are you feeling?
Good.
Good. Okay. Okay, so that's been 15 minutes. So we're just going to go ahead and stop the treatment. And then before it's completely stopped, now I'm going to release this. Perfect. Okay, so I just want you to lay here for about 4 to 5 minutes to just make sure that you're nice and relaxed after the treatment, okay?
Mm-hmm.
Okay. Okay, great. It's been 4 to 5 minutes. Are you feeling any dizziness?
No.
No? Okay, perfect. So I'm just going to have you, I'm going to take everything off, and then we're going to, again, test your range of motion.
Okay.
Okay? So go ahead and stand. Perfect. Good. Okay, I'm just going to take all this stuff off. Again, no dizziness?
No.
Step out. Perfect. Okay, so now we're just going to test your range of motion. Okay, so can you just, again, go ahead and reach forward and touch your toes? Good, and I'm just going to measure again that. Great, and that's definitely an increase in range of motion. Now we're going to, again, just do this motion. So you're just going down and make sure you're staying nice and neutral. Great, and I'm going to measure. So you're here, and then go ahead and come back up, and go to neutral, and then you're here. Just going to measure that distance. Perfect, and you definitely gained some range of motion, so it seems like your treatment is successful. Do you feel any signs or symptoms?
No. Decreased pain.
Good, perfect.